How do desensitization techniques work? Have you ever wondered how desensitization techniques help people cope with trauma? These methods are crucial in trauma-focused cognitive behavioral therapy, often known as TF-CBT, and they aim to lessen the intense emotional reactions tied to traumatic memories, especially in those with post-traumatic stress disorder. The core idea behind desensitization is to gradually expose individuals to trauma-related thoughts, feelings, or situations in a safe and controlled way. This helps the brain and body process the trauma without becoming overwhelmed. One of the main goals of desensitization is to weaken the strong emotional responses that trauma reminders can trigger. This is achieved through a process called habituation. Essentially, repeated and controlled exposure to trauma cues reduces the distress they cause over time. Alongside this, cognitive restructuring plays a role by helping individuals identify and change unhelpful beliefs related to the trauma, such as feelings of self-blame or exaggerated fears. A well-known desensitization method is eye movement desensitization and reprocessing, commonly referred to as EMDR. In EMDR, a patient recalls traumatic memories while engaging in bilateral stimulation, like moving their eyes from side to side. This method is thought to help the brain's natural healing processes by changing how traumatic memories are stored, which can reduce their emotional intensity. Research indicates that the benefits of EMDR mainly come from the exposure and cognitive behavioral aspects, rather than the eye movements themselves. Another approach within TF-CBT combines gradual exposure with training in relaxation and coping skills. Before facing trauma memories, individuals learn strategies to manage their emotions and thoughts. This preparation helps them handle the distress that comes with exposure therapy, where they mentally revisit traumatic events in a safe environment. Over time, as they repeatedly confront these memories, the emotional charge linked to them decreases, leading to fewer PTSD symptoms. Desensitization techniques are backed by evidence and are recommended by major health authorities for treating PTSD. These techniques are typically delivered over several sessions and are tailored to meet individual needs. They often include education about the trauma, relaxation training, cognitive restructuring, and gradual exposure to trauma cues. The aim is to empower individuals to regain control over their trauma-related distress and improve their overall functioning. In summary, desensitization techniques work by safely and gradually reducing the emotional impact of traumatic memories through controlled exposure and cognitive processing. This helps individuals with PTSD heal and regain emotional stability. These techniques are key components of trauma-focused therapies like TF-CBT, prolonged exposure therapy, and EMDR, all of which are supported by strong scientific evidence. If you or someone you know is struggling with trauma, it is important to consult with a healthcare professional for personalized guidance.